Hello everyone, this video is about immunosuppressive agents and organ transplantation. Please listen attentively, thank you. Good morning, I've already registered your name on the waiting list for organ transplantation. Huh? So I have to wait for a long time? Organ transplantation is not as simple as you think. Let me explain more about it. There is a thorough assessment which is needed before transplantation. First of all, we need to determine whether your condition meets the criteria for transplantation. Second, we will fill in the form of organ transplantation waiting list according to your severity and urgency. Take liver transplantation for example. Higher scores mean your condition is more severe and urgent. Third, if your application is approved, we would upload and register your information on Taiwan Organ Registry and Sharing Center, which we call TORSC for abbreviation. Then, TORSC will prioritize patients based on their scores. Lastly, the entire transplantation process will start up if you are matched. Can I just ask my family member to donate? That would be much faster. If it's legal, it will be faster if your family member can be the donor. However, we still have to evaluate both you and donor's physical and mental health and take some examination to make sure that you're matched for transplantation. Oh, I get it, but what do you mean by match? Our main goal is to reduce rejection reaction. As a result, it is necessary to examine whether the receiver's and the donor's antigen are compatible before the operation, such as HLA and ABO antigens. HLA stands for human leukocyte antigen, which acts as a marker recognized by our body and is the most important antigen related to transplantation. If HLA detects foreign cells, it would activate an immune response, also known as rejection reaction, which plays a key role in affecting the survival time of the organ. Hence, it's important to check whether the antigens match before transplantation. What if the donor and I have different blood type? That's a good question. In that case, we may use plasma exchange along with specific medications to reduce the chance of rejection reaction. It says that there will be post-surgery rejection reaction. What should I do then? We will give immunosuppressive agents to cover that up. Let me provide more details. Generally, thymoglobulin, Simulate, and Solomendron will be used as induction therapy for the prevention and treatment of rejection. However, there are some side effects that you should be aware of. Therefore, we will select the more suitable option based on your condition. In addition, taking oral immunosuppressive agents after transplantation to lower the risk of rejection is necessary and important, since it's impossible to completely avoid any rejection reactions. However, we can lower the risk effectively by combining drugs with different mechanisms, including calcineurin inhibitors, mTOR inhibitors, anti-metabolite agents, and steroids. The first one is calcineurin inhibitors, including sedamineural, Prograf, and Avograf. All of these drugs have different dosage forms. There are some common side effects, such as hypertension, nausea, and vomiting, as well as headaches. For sedamineural, patients, especially young people, should practice good oral hygiene due to there might be gum bleeding. Moreover, doctor will monitor blood concentration before administering the drug. Therefore, it is recommended not to take the medicine while or before drawing blood. Please take the medicine to the hospital and take it after the blood has been drawn. The second one is mTOR inhibitors, which include Surticant and Rapamune. There are some common side effects, such as hyperlipidemia, hypercholesterolemia, and hypertension. As a result, people with these three conditions should pay more attention to their management. Additionally, female patients should avoid getting pregnant while taking medicine and at least for 2 months after stopping the medication. The third one is anti-metabolite agents, which include Cellcept, Myfortic, Immuran, and DP-ethothirapine. Among all, Cellcept should be wholly swallowed to avoid stomach upset, and Myfortic cannot be grinded or separated in half. Common side effects are weakness, headache, and bruise. If you notice hematuria, blood stool, or severe dyspnea, please go to hospital as soon as possible. Additionally, avoid using antacids that contain aluminum, magnesium, or drinking milk and protein-rich food with medicine at the same time. These drugs cannot be used by pregnant women. The last one is steroid, which include prednisolone and methisone. These drugs are usually combined with other immunosuppressive agents with anti-inflammatory effect. Common side effects are peptic ulcer, elevated blood pressure, hirsutism, weight gain, and osteoporosis. It is suggested to consume these drugs with food to minimize gastric irritation. Since immunosuppressive agents lower your immunity and immune response, you may have higher chances of infection. So, we will add on antiviral agents to prevent any infections, such as viruses, molds, bacteria, pneumocystis jirovecii, and Mycobacterium tuberculosis. I've been taking medicine for my hypertension. Is there anything that I should be aware of? Drug-drug or drug-food interactions are very important. Let me tell you more about it. Some of immunosuppressive agents, such as cyclosporine, Prograf, and Certican, are metabolized by our body. If we take any medicine or eat any food that induce enzymes to metabolize immunosuppressive agents, their concentration and potency will decrease and then increase rejection risk. On the contrary, if we take any medicine or eat any food that inhibits enzymes to metabolize immunosuppressive agents, its concentration and potency would increase and may cause paresthesia and secondary infections. Now, let me introduce some common enzyme inhibitors, including antibiotics, antifungals, antihypertensive agents, antiviral agents, and antiarrhythmic agents. These drugs may increase the concentration of immunosuppressive agents and should be taken with caution. However, other drugs and even traditional Chinese medicine and certain foods may still have interactions with immunosuppressive agents. Therefore, it's important to inform your doctor and pharmacist about all medications and supplements you are taking. Additionally, some healthy food like coptis, grapefruit, and red wine may also increase the concentration of immunosuppressive agents. It's best to consult your doctor or pharmacist before making any changes to your diet or medication regimen. These are symptoms that may be caused by higher concentration of immunosuppressive agents, including liver and lung damage, increased blood pressure, headache, epilepsy, tremor, paresthesia, and infection. Among these, infection is the most important because higher potency leads to lower immunity, which increases the risk of infection. Next are common enzyme inducers, including anti-tuberculosis agents, epilepsy agents, and traditional Chinese medicine, which may cause concentration of immunosuppressive agents to decrease. If the concentration is too low, it may lower drugs' potency. Then, the risk of rejection would increase and ultimately affect the survival rate of the organ. Since concentration plays an important role in the therapy, the doctor would monitor it regularly to ensure safety. Other interactions, such as ginseng, cornflower, and some healthy food, may also increase the risk because they can increase our immunity and further reduce the potency of immunosuppressive agents. On the other hand, red yeast rice and lipid-lowering agents may cause rhabdomyolysis-like symptoms such as arthralgia, dark urine, and fatigue. So, please ask your doctor or pharmacist before taking any healthy food or drugs. What else should I be aware of? Such as side effects, long-term risks, and other things that I will tell you later. Long-term use of immunosuppressive agents has some side effects and future risks as following, including 3 highs: osteoporosis, high infection possibilities, and higher chances to suffer from cancer. What if you forget to take medicine? Let's take twice a day as frequency for example. If you're supposed to take medicine at 9 a.m. and 9 p.m. with a 12 hours interval, we can set half of an interval, 6 hours, as the dividing line. If you remember to take your medicine before 3 p.m., you should take it. But if you remember after 3 p.m., skip that dose. Don't take 2 doses at once. Before you discharge from hospital, please prepare an A4 size pill base to put medicine orderly and set alarms to take medicine. For vaccination, attenuated vaccine should be avoided due to infection risk, and inactivated vaccine is safe to inject. However, there are 2 types of zoster vaccine. Please choose the inactivated one. As for COVID-19 vaccines, they are all safe to be injected. To sum up, please ask any medical staff if you have any need for vaccination. Let me remind you again. First, please take medicine on time and make regular appointments. Second, keep good personal hygiene. Third, avoid eating raw food. Fourth, refrain from smoking and drinking alcohol. Lastly, remember to inform your doctor if you have plans for pregnancy recently. Left one is the app from Tri-Service General Hospital. You can download it on your device and it will provide you more medicine information. If you have questions or want to consult a pharmacist, you can make an appointment for pharmaceutical care. Last, right one is detailed information about transplant medications. There is a link below and you can download it after watching the video. These are members of our transplantation team. It's important to stay in good contact with medical team and please feel free to ask us if you have any questions. After listening to previous introduction, do you feel more knowledgeable about transplantation and immunosuppressive agents? Please scan the QR code below and take a quick test now.